Myself, Dr. Tabrez Khan. I have my own private clinic in Keshapur, and my clinic's name is Dr. Khan's Clinic. So I'm a general practitioner. Now, today my topic for this talk is what to eat and what to avoid if you have Barrett's esophagus. Okay, so I'll explain you about Barrett's esophagus. What is it condition called as? So Barrett's esophagus is a condition where the tissues of the walls in the walls of your food pipe change their appearance due to long-term exposure to the stomach acid. So this condition is common in people who have suffered from acid reflux for a long time, or for those who suffer from a condition known as gastroesophageal reflux disease. This is known as GERD. So people who are affected by this reflux disease, so they have a higher chance of developing cancers. So that is why like this disease on its own does not have any specific symptoms, and this is caused by something irritating the walls of your food pipe for a long time. And the symptoms will be of that specific conditions. Like Barrett's esophagus is commonly seen in people suffering from GERD. Such people will have like symptoms like heartburns will be there, and they'll be having a difficulty to swallow some food or this thing. And then sometimes they also feel chest pain due to severe heartburn. And this condition is usually detected by taking a look at the esophagus using a flexible tube with a camera at the end of collecting small samples of the cells and looking at them under a microscope. And so that's why there are many ways of managing this condition, including the use of medicines which prevent the production of this stomach acid. So following a proper diet plan also can help the and reduce the symptoms of GERD. This will help lessen the chances of developing Barrett's esophagus. So if you have this frequent episodes of acidity, or people who suffer from GERD, avoid eating acidic foods like citrus fruits like lemon or oranges and tomatoes. So then limit all or completely avoid alcohol. Okay, and do not smoke. Specifically, do not smoke. Avoid eating chocolate. So, as I was telling, do not consume any fried or high fat or spicy food items, so that the reflux shouldn't be coming. And chocolates also, and then caffeine or coffee intake. So these all things should be excluded. And then usually we advise the people to eat meals in a proper, like small proportion and proper timings also, instead of larger meals throughout the day, and wait for few hours after eating and after and before lying down positions. Okay. And then if you have been suffering from any acid reflux or heartburn for a long time, you should discuss with your doctor about the possibility of developing the Barrett's esophagus usually. And then there are some references. So Mayo Clinic, this thing is there, Barrett's esophagus, and then NIDDK, symptoms and causes of Barrett's esophagus online. And then NIDDK, we have diagnosis of Barrett's esophagus, and then we have treatment for Barrett's esophagus, this thing. And then fifth one is eating, diet, and nutrition for the Barrett's esophagus. So NYU Langone Health. So health lifestyle changes for Barrett's esophagus also is available. Clinical experience usually see where we have severe gastritis and severe GERD patients. So usually we prefer, first of all, we prefer them diet. Okay, as I've explained about the diet, like use less oil and less spicy foods. So after that, if it's not reducing through the diet, also we mention some few medicines for them. Like example, we have esomeprazole and we have the etopride also. So usually we, for severe GERD patients, we can give these medicines, prescribe these medicines for a long, I mean, not so long. Usually what happens, some few antiemetic and antacid medicines, they'll have for long exposure, they'll be having vitamin B12 deficiency. So usually we need to just cut down and tell them to maintain a diet at least for 2 to 3 months, a proper diet. And then also we can add medicines with that. Maximum for a month we can add, so that it will get controlled.